So this patient was a 65 years old male. He presented to the emergency department with a typical chest pain, and he's a known case of hypertension, diabetes, and on ECG there was a mild ST depression in the anterior leads, and echo was normal. There was no RWMA, and TROP-T was almost 700. So obviously the patient was taken for the angiogram, and this is a right radial root, and you can see this is the iliacaudal view. A high OM, or you can say the ramus is was totally occluded, and there's no flow in this OM1. LCX is normal, and in LAD in this ariocaudal view, clearly you can see there is a total thrombotic occlusion in the OM1, high OM1. So after obtaining all clearance, patient was taken for the angioplasty to this OM, and this is a right radial root. You can see how LM was a short. In short LM, the particular problems are there, like you cannot take the XB, and you have to do with the JL because it is a short LM and there's a chances of dissection and all. But then the problem of support is there. JL don't give support during the plasty, and you can see here. So I started with the right radial root with the BMW PTCA wire. It was my workhorse wire, and it took me 2 to 3 minutes to cross this, and there's no flow even after crossing. So I decided to do the balloon daughtering, but balloon was not going and there was no support. You can see this JL was not giving any support, and it was coming out while pushing the wire and pushing the balloon, but I could not do the balloon daughtering. So somehow I managed to push the balloon. It was end balloon, and end balloon only could go inside, and predilatation was done, and you can see now the flow in this OM, big OM with branches. You can see it was a very tight lesion, thrombotic lesion. So now the second challenge was waiting for us. So while pushing stent, you can see the catheter was going back, falling back, and everything went out. So it was very difficult to progress the stent because there was no support with the JL. So this was the picture, and then what to do? Then I decided to change the catheter because there was very minimal support with the JL. I took the XB3, and while I was very careful, and I parked one more wire in the LAD and one in the OM, so that I'll get the support and there would not be any injury to the left main, as it was a short left main. And then with support of the LAD wire and this catheter, I managed to push the stent in the OM, and it was inflated at around 12 atmospheric pressure. Nominal was 8. It was a 2.5 into 20 stent, and then we could achieve the TME3 flow in this OM, and you can see how big the OM was. So now you can see that OM, the TME3 flow is there, and this is the angioplasty of this OM in this short left main. There's a challenges while doing angioplasty in the short main, left main. So we have to try the different strategies. You can have a wire support in the 2-3 vessels. So this was the angioplasty to the OM.